You may think that Medicaid always covers air ambulance costs, but it's not that simple. In this video, I'll explain when Medicaid covers these services and how to avoid unexpected bills. Hello, my name is Dr. Frantz Colin. I'm the Director of Utilization Review and Patient Advocacy at REVA Inc. There's a lot to understand about the cost of air ambulances. Check out our other videos to learn what you need to know. Does Medicaid cover the cost of an air ambulance? Medicaid does cover an air ambulance if participating in the state. So there are situations when Medicaid has to be in network with our organization. There are certain states, including Virginia, Indiana, Texas, and Florida, where Medicaid is in network. If a patient has Medicaid from another state, it must be in network with us as the provider in order to establish movement and progression with authorization for air ambulance services. There are situations where a single case agreement would be created with the Medicaid center as we are able to establish in the specific states that the patient is from. If the patient is not from a state where we are in network with the Medicaid provider, then we will not be able to assist and provide medical support, and the patient will have to self-pay for the services. In what situations will Medicaid cover an air ambulance? Air ambulance is covered through Medicaid in non-emergent and emergent situations. However, it is important to note that Medicaid providers have to be in network with the state where the patient has received their Medicaid program. Medicaid will cover, again, non-emergency and emergency transport, as well as getting the patient to the nearest and closest location that they can get the resources and services available to get treatment. So Medicaid coverage is generally a federal government program that is provided to the underserved community. These individuals are individuals who are generally making minimum wage or less than the middle class, and the insurance is covered through your state. Medicaid will request an authorization to be completed prior to any services being performed. Once the authorization is received, there is an ability to establish a single case agreement that would be provided to the Medicaid company in order to pay for that service on your behalf. Every state has Medicaid. However, the provider has to be in contract or in relation with the Medicaid state in order to move forward. We do have established Medicaid providers in Indiana, Virginia, the state of Florida, and we're working on several other states at the moment. What is the process for booking an air ambulance with Medicaid? When you call in to seek air ambulance support, it is important to let the operations specialist know that you have Medicaid. In that situation, we are able to identify what state you have your Medicaid coverage from and if we are in network with that state. If we are not in network, we will not be able to assist, and a self-pay option will have to become available. If we are in network, we're able to reach Medicaid and let them know that we would like to move forward with an authorization or approval, provide medical necessity based on the medical care that you're receiving at the current location where you're at, and then when approval has been met, we're able to establish a single case agreement that will allow for the payment to be completed by Medicaid to your provider. When it comes to Medicaid, there are not any out-of-pocket costs. You have the service provided to you by the federal government, and the care that you receive will be identified by Medicaid as medically necessary, and that coverage through the single case agreement will establish the payment to the provider. So therefore, you will not be responsible for deductible or out of pocket when it comes to Medicaid.